Good afternoon, ladies and gentlemen, our dear viewers. Welcome to this new episode of Medcast. Today, we are so pleased to have Dr. Mohammad AlJazea back again here in Medcast to discuss the latest trends in the pediatric health. Welcome, Dr. Mohammad.
Good afternoon.
Dr. Mohammed, in the last episode, we have discussed the let's say the winter diseases, which is mainly the infections or the flu or the influenza. In this segment, I would like to know more about the vaccinations, which have made a very big change in our children's health. And they say this is probably the best invention in the last 50 years. So can you please define the vaccination and where we can use them?
Uh, you're right. I do agree that this is one of the greatest inventions in medical history, where we use a substance
Hmm.
that can induce your immunity to help you fight the a known virus that has been lethal for a long time.
Hmm.
Let's say the flu vaccine, the corona vaccine, the measles, the mumps. This has been very um, big game changers in the last, let's say, 80, 100 years of
Hmm.
it. And there are certain well-known vaccines that has been used for years, and it has proven the efficacy of the vaccination in helping to minimize the spread, let's say, of these illnesses. And by the way, nowadays there is a new vaccine. It's called RSV vaccine for a very aggressive virus that has been overwhelming the hospitals for years and years,
Hmm.
and it affects children who are younger than 2 years. And it's in some instance it could be a killer
Fatal. Yeah.
and very fatal.
Mm.
And now it's in Kuwait now, and we have started giving it to the children, and inshallah, it will minimize the number of
Is it
admissions
is
in
it
the hospital.
compulsory in the vaccination
It
table?
is not.
Yeah,
It is not.
it is not
It's
yet.
the first year
Yeah.
all over the world, and it's the first year in Kuwait, and hopefully it will be compulsory in the future.
That's great. Now, I know we do have other types of vaccinations, as you have mentioned, that are compulsory in the vaccination table, and they helped effectively to minimize the number of the patients we have from that illness. But still, there are a very big debate about the safety
Yes.
use of these vaccinations, and some people might also prevent their children to take the vaccinations.
Yes, yes.
How do you comment on that?
So there are a big groups now growing globally
Yeah.
who are anti-vax,
Mm.
who doesn't give their children the
The vaccinations.
vaccinations. Uh, I recall one of the, I think in 2023 or 22, uh, there is an outburst of the measles virus
Yeah.
in Europe and in the States.
Mhm.
And the number increased by 20% because over 120 million children have not received the MMR vaccine,
Mhm.
and this fatal virus has reoccurred, resurfaced again, and it's and I think there are some myths around the vaccine where people think it could cause autism for some
Autism.
children.
Yes.
So that they say it's not as good as the real or the normal immunity that the children have, and some of them would say it's not needed because the diseases are rare.
Hmm.
But if you see the changes, these diseases has been rare because of the use of vaccines for years and years ago.
Yes.
And now when when people start to stop taking them, these diseases has recurred or resurfaced again. So I believe that these families has to be educated well and given them information that are evidence-based information from a very well-known trustworthy centers, and you have to take your time with them and try to see what's the idea behind it, giving them the vaccination, and then you come back with your proofs and your evidence and tell them that how vaccines can help their children and um, protect them from these fatal
Now, there is
diseases.
another conception because you have mentioned children with every time you mentioned the vaccinations. So does that mean that the vaccination is only used by children and cannot be used by adults somehow?
That's another misconception
Yeah.
that some people think that vaccinations are only for children,
Hmm.
but there are vaccines for older people, for people who are immunocompromised, who are people over the age of 65 or
65, yeah.
75, that can protect them from a very simple virus that could be fatal for them.
As we have now in Kuwait, the winter vaccinations as well as the HPV as well, is
Exactly,
it intended to be used by the adults?
exactly.
With the existence of these vaccinations and that technology that helped the people since very long time, still there are some people since long time they believe in something called herd immunity, especially with the children. And I think our families used to do that when we were children and
Mm,
used to put us all
mm,
together when
mm,
somebody had
mm, mm.
chicken pox, if you remember, and
Yes,
say
yes,
let
yes,
him infect the
yes,
others.
yes, yes.
So, what do you comment about that, the
Yes.
herd community point?
So herd community, it doesn't mean that only people who are getting sick and got the antibiotics, they will have a herd immunity. So the concept of herd immunity is the number of people in the community that is needed to have um, a protection from these viruses to be spread.
Hmm.
Let's say, for example, measles. If you need the herd immunity for a community, you need around 90% of the population to be immune against the measles, in order for them for the community not to spread it from one to another.
So, only 10% is not vaccinated?
It doesn't matter.
Yeah,
But and for example, in COVID, the herd immunity, you need 50 to 60%
yeah.
for the herd immunity or the herd protection to be effective in
Hmm.
this. So whether you have it because of if you got the sickness itself, or you got it from a vaccine, then the herd immunity will be there.
Yeah.
So not only that you need to get sick to have the herd immunity, even if you get the vaccination, you'll have a protection or herd immunity in the community.
Also, there is a very big group of people thinks that the vaccination doesn't go under testing or clinical trials. So, how would you comment on
No,
that?
no, that's impossible.
Yeah.
So in order to have the vaccine approved,
Mm.
there are certain pathways that you have to go through, and it can go up to 15 years
Mhm.
to get the approval. But there are some certain situations where you can get the approval within 2 to 3 years. That's what happened with the COVID. But let's say if you need a new vaccine, there are 4 or 5 phases that you have to go through
Yeah.
until you get the approval of the WHO or the CDC or the AAP.
Yeah. No.
So years and years of trials, of studies, of monitoring, of approval before, or and safety, before you get the vaccine in the community.
Now, with all what you have said, it should be clear for the parents how important is the use of the vaccinations for their children's health. But yet, there are some parents that are hesitant in using them, especially when they don't have enough information about them. What advice would you give to those parents regarding the importance of the use of the vaccination for their children?
I would tell them that these vaccines that we have in the schedule in Kuwait that has been adopted by the WHO
Hmm.
has been proven to be very safe, effective, without any contraindication, any side effects for their children. And if you read about these diseases that our vaccines protects against them, you'll find these very lethal, aggressive viruses that could be even if they survive, they would survive with a very
Low chance of some, yeah.
tragic consequences, let's say brain death or CP or some other issues that you could avoid them by taking a simple vaccine.
That's great. Now, as a closing for this episode, we have a very general question. We should make it like an opening for another episode. Now, people think it's like a mathematical equation, which is 1 plus 1 equals 2. A vaccination plus a children equals autism. Can we say that the autism is only caused by the use of vaccinations, or there are other things that may lead to autism in children, especially?
It has this myth has debunked by years ago,
Yeah.
and there is no correlation between autism and vaccine.
You know what's the point? with the increased use of the technology these days by the children, and keeping their children alone and not interacting with their environment around them, I think this could be one of the reasons that the patient or the children are having increased numbers of autism. But some parents still believe that the cause or the main cause of that autism is the use of the vaccination, despite the vaccinations being used for
For years and
even
years.
more than 40 years.
I don't think so. I have my own opinion about this. I believe that autism has been there for centuries
Yeah.
and no one knew about it. But the awareness and the diagnosis of autism start to increase, let's say, in the last 30 years.
Mm-hmm.
Now, because of the criteria that we see in their children and the signs and symptoms in the children, now we know that this is autism. But let's say 30 years ago, if you see a child who is mute or he is not interacting or he's not looking at your eyes, some people they call them crazy before.
Yeah. And
So
they
now,
use and
because of the awareness, we know some people start to think about autism or talk about
yeah,
autism.
and because of the availability of the information as well, because on
Exactly.
that time they were saying always that when he grows up he will change, especially the
Yes,
parents, because they have
exactly.
a belief that this is the normal childhood. So
Yes,
when he gets into adulthood, then he will
he
change
will
himself.
change. Yeah.
Dr. Mohammed, we are so pleased to have you, and the
Thank you
discussion
very
was so
much.
great with you. Hopefully we can have you again
Thank
here.
you very much. Thank you.
Thank you
Thank you.
very much. Our dear viewers, we have reached to the end of this segment of Medcast. Hopefully we can see you again with a new specialist. See you again at that time. Goodbye.